So, what can you do to decrease your risk of getting fibroids? And this is particularly important for the women in this room to try, a lot of women want to manage their health with nutrition and other non-invasive techniques, and I support that. I believe that a surgery or a procedure should always be avoided if it can be avoided. So, we're going to talk about things that increase and decrease the risks of fibroids, and it's also important for women who've had treatment, and unless you've had a hysterectomy, fibroids can always come back. So these techniques, these things we're going to talk about, they can help prevent recurrence of fibroids. So let me just ask the audience, you guys, I'm sure you guys know some things. What are the things that decrease your chance of having fibroids? Anyone?
Eating more green, dark green leafy vegetables.
Green leafy vegetables, absolutely.
Less fat in your diet?
Less fat is great, yes, absolutely. Anyone else? I hate when people quiz me during a talk. Okay, so the things that help you are, oh, look at that, you see the spot on the wall but not on the screen. That's not fair. That's completely not fair.
That is weird.
Okay, so here, let's see if this works. That doesn't work either. Okay. All right, so fruits and vegetables, especially citrus. It's interesting. Of all the fruits, citrus is the best of the fruits for preventing or decreasing fibroids. And I'm sure it has something to do with vitamin C, but when you study vitamin C as a vitamin, that doesn't necessarily help. But citrus does. Healthy vegetables, green vegetables, definitely. Dairy. Dairy is protective for fibroids. Now that probably has something to do with vitamin D, because a significant risk factor for fibroids is vitamin D deficiency. And who has vitamin D deficiency? Black women. So vitamin D, exercise. And you know, this is my example of a woman who's not doing strenuous, going out and sweating exercise, yoga, just doing some exercise, 20 minutes 3 times a week, is protective for fibroids. Things that increase your risk are sugary foods, foods like candy bars and cakes and ice cream and all those things that cause a spike in your insulin level. Everyone's talking about insulin resistance these days. Those things all increase your risk of fibroids. Red meat. That's nothing new. We all know that red meat causes problems. Red meat, alcohol. Interestingly, wine is not so bad. Wine in moderation is not a risk factor, but beer is a risk factor. Hair relaxer, big controversy. Okay. So I was on a radio show and somebody asked about hair relaxer, and I said I really don't know. So I went and did the research, and I read the papers on this. So here's the bottom line. Fibroids are fed by estrogen. We know that fibroids are fed by estrogen. So the more exposure you have to estrogen, the higher risk of fibroids. Estrogen starts when you start your periods. It stops when you go through menopause. So women who have menopause later, they're more likely to have fibroids. Women who started their periods earlier, they're more likely to have fibroids. When you have a pregnancy, your body's progesterone level rises relative to your estrogen levels, and so somehow, I think about this in terms of your estrogen level relatively is lower. So women who have a lot of pregnancies have a lower risk of fibroids than women who have no pregnancies. You have a higher risk of fibroids if you've never been pregnant. So along that line, hair relaxer has a chemical in it called a phthalate. It's spelled P-H-T-H-A-L-A-T-E, phthalate. It simulates estrogen in the body. And the studies show that there is a dose-dependent relationship of hair relaxers. For women who've used long-term hair relaxers, the more number of years you used it, the higher your risk of fibroids. The more number of scalp burns you've had, the higher your risk of fibroids.
Can you spell that again? Can you spell it again?
P-H-T-H-A-L-A-T-E, phthalate. And phthalates are in lots of items that we use every day. Food containers, drink containers. It's kind of like, pardon me?
Plastics?
Plastics, yes, phthalates. But hair relaxers like this big dose, right? You know,
Yes.
burn your scalp, let it soak in. Radiation, this is something that unless you've had some sort of pelvic radiation, this information comes from Hiroshima, from the nuclear bombs. Women who were in the region, much higher incidence of fibroids. And anybody here a DES baby? If you don't know what it means, then you're not, so don't worry. It was a chemical it was a medicine that some women took during pregnancy in the 50s, and their daughters have increased health risks, types of cancer in the reproductive organs, and also fibroids. So those are the risks and the protective factors for fibroids.